We are so lucky to have world-class medical care right here on the Suncoast without having to travel far from home. Dr. Rekkas was raised on Anna Maria Island, and he returned to provide medical care right here in Manatee County. And Dr. Rekkas joins us now to talk about his specialty in bariatric and robotic surgery. I love the story that you've always wanted to be in our area and have returned here to practice, so thank you for that.
Yeah, thank you. I mean, I love this area. I grew up in the area, and even though I spent a lot of time outside of the local area getting my education done, I knew I wanted to come back to be with my family. I think it's one of the best places to be in Florida. Yeah,
well, we certainly all agree, that's for sure. Let's talk about bariatric surgery. It's been around for a long, long time, but it has changed, certainly, in how it works for you and also how it benefits people. Why is it something that can truly help a person not just look better, but feel better completely?
You know, weight loss surgery has been around for a long time, over 60 years, but really in the last 20 years, we've gotten really good, very efficient, and it has changed dramatically. So weight loss surgery used to be this very invasive procedure where people would have large incisions, stay in the hospital for days and weeks, and now we figured out a way to do our surgeries robotically, and that means that patients are having surgeries that used to take hours, sometimes get done under 45 minutes. They're only spending one day in the hospital, and the outcomes that we've seen, the benefit we've seen to our patients as far as curing diabetes, sleep apnea, decreasing their risk of cancer are really immense and amazing. So we've gotten very good at doing it to the point now for most of our patients, their risk is only about 1 to 2%. So it's some of the safest surgeries that we can offer patients with the most benefit.
Yeah, it really is life-changing for many, many people. Let's go back to the robot part, because I feel like a lot of people think robot. I mean, it's one thing to trust your hands, but to trust a robot, that feels a little more intimidating. I know you gave us some pictures that we could share. Explain how you work in conjunction with technology and how that technology helps both you and the patient.
So first off, I think it's important to realize that the robot's not doing the work, okay? I wish there was a button that we push, but it's important for patients to think of it like this. The robot is like an extension of the surgeons. So now, instead of operating on someone kind of near them and on top of them or using instruments, I'm actually seated down. And when I sit down, I have a three-dimensional view, so that means I can control the robot. So every action I do kind of turns into an action of the robot, and I can see clear. I see things magnified. Things are three-dimensional. And really, we found, instead of having these big cuts, our patients are having small little incisions, and it has dramatically helped how I think surgeons have been able to operate and take care of their patients.
And I think visually, for you to have such a much better look at such an important time is really, you know, wonderful that technology is able to help that.
Yeah, no one wants big scars anymore. You know, no one wants to be in the hospital, and you talk about decreased pain, decreased bleeding. So it's just
better recovery time, I would assume.
Absolutely. Our patients are going back to work in about a week or so. So it's really cutting edge, and I think we're very fortunate that we have the ability to bring this to the community.
I feel like bariatric surgery often gets the rap of, you know, maybe somebody being a little vain or, you know, tired of being heavy. Help us understand why being heavy is more than just your appearance, the strain and the toll it takes on your body.
You know, it's an interesting time. Now, we have about 40% of our country is overweight, and there's a price to pay, and of course it affects how we look and feel about ourselves. But when the body's carrying this extra weight, specifically our patients are at risk for heart attack, stroke, diabetes, sleep apnea, the cancers like we talked about. But the cool thing is, the amazing thing is, when we help our patients lose that weight, those risks go away. So not only do they look better, but more importantly, they feel better, they live longer, their quality of life gets better, and it affects every part of their life. So getting to be a part of that success as a weight loss surgeon is super gratifying, and I love my job for that.
When a patient comes to you, how do you determine if they're a good candidate for this bariatric surgery?
There are specific criteria that we follow for every patient that comes in, and specifically we want to make sure that they are educated. We provide them with a dietitian service. We provide them with a bariatric program. They have coordinators they work with, but most importantly, we start at ground level and we say, hey, what are you doing for yourself? What can we improve? It's diet, it's activity, it's exercise, it's all that. And we are like their cheerleaders. We are their coaches. We push them, so we want them to do well, but everyone has a customized plan.
Yeah, and it's not a magic pill. You know, you don't just walk in, get a surgery, and walk out skinny. Obviously, patients have to do the work as well. I don't think we should underestimate that.
Absolutely. And the important thing to realize is weight loss surgery is not cheating. It's just a way of patients coming in and saying, hey, I need help. And when you have a patient that's motivated, that wants to change, these tools are absolutely amazing and life-changing.
And again, we're lucky to have this kind of technology and your skill set right here on the Suncoast. So thank you for coming in to explain. To learn more about bariatric robotic weight loss surgery, it's happening right here on the Suncoast. You can find Dr. Rekkas by going to manateememorial.com. We'll be right back.